Doctors In segment this morning, we were talking about Black maternal health. This week is Black Maternal Health Week. Health professionals every year at this time try to raise awareness of the racial disparities in maternal health, especially when it comes to Black women. According to the city's health department, Black women in the city are more than 12 times more likely to die from pregnancy-related complications than white women. Black women experience severe maternal morbidity, life-threatening complications during pregnancy, childbirth, or the postpartum period at the highest rate of any racial group, 457 cases per 10,000 births. These alarming disparities underscore the urgent need for targeted systemic interventions to improve maternal health outcomes for Black women. Joining us now this morning, Dr. Thomasina Ellison. She is the Associate Director of Gynecology at Maimonides Health in Brooklyn. Great to have you with us this morning.
Good morning.
Such an important topic. When you hear that number, that Black women in the city are more than 12 times more likely to die from pregnancy-related complications than white women, as a medical professional, what does that do to you? What do you say to that when you hear that?
Needless to say, that's disheartening. Right? Yesterday, I was at Brooklyn Borough Hall celebrating Black Maternal Health Week, and I shared that 30 years ago, when I was in labor, on the way to the hospital, I told my husband, I informed him that every woman who goes to have a baby doesn't come home or doesn't come home safely. And now 30 years later, we're still in this situation where we have moms who are going to have babies who are not coming home and not coming home safely. And this is to say, having practiced for more than 3 decades here in New York City, it's a little bit discouraging, to be honest with you. But the fight will go on. We will push on.
And we should point out, most of these pregnancy-related deaths are preventable.
Yes, they are. We're talking about preventable maternal deaths. That's what we're talking about. And that's even more so in our country, in our world, that we are still talking about this 3, 4, 5, 6 decades later.
It's not just a problem here in this city.
Look at the condition of the family
CDC says
structure
that pregnancy-related deaths among white women dropping, but that's not the case among Black women. So we hear about racism within the healthcare system, lower health insurance coverage, access to care.
But you're not hearing about federal funding initiatives.
You see all 3 of those
Yes,
factors?
absolutely.
And family court corruption and abuse.
Structural racism is so very deep into our world. I remember hearing
it's so very deep in the argument.
DNA, that access to care, understanding what's going on, having a provider who can speak to your issues within the facility that you're being cared for and outside of the facility, what's going on at your home. Do you understand the importance of
complete anarchy going on at the home?
Can you get the right foods to support your pregnancy? Can you get to your doctor or your midwife? Do you have access to a doula? Are there community programs that support you in your pregnancy? Such as you would have maximum care so that when you go to the hospital or at the birthing center, that you would have a good delivery, that you would come home safely. So these are the things that we're still pushing for. We're still pushing for programs that are impactful. And oftentimes those programs need to be designed by the mother, the woman, the birthing person, right? So a doctor could say, I think you need this medically, but socially, what do you need to get to the point that you're optimizing your medical care?
Financially, how are you going to do it?
Later, decades.
Uncle Sam.
What are we not doing that needs to be done, do you think? What's missing?
Restoring fatherhood, motherfucker. That's what they're not doing.
What's missing is not having the patient at the table of discussion, right? And planning so that we can have programs that are impactful specifically for her and her family situation. As I say, structural racism, very deep roots. We need to dig those roots up. And that goes outside of healthcare in and of itself, right? Proper housing, right? Transportation issues, employment issues so that you can be properly insured, right? No woman should have to have the issue whether her insurance is active before she shows up to her care provider. So lots of steps, multifaceted. It cannot just be a narrow lane that we're walking down to improve health.
Yeah, a breeder's market.
More about
a breeder's market.
Maimonides that is sort of, trying to target this issue.
Well, Maimonides has the largest maternity care in New York City. Partly is because the area that we're located in is an area that houses lots of Orthodox Jewish women who are very reproductive and having lots of children. And for this reason, we are very focused on having the best outcomes because of that. So what we do, we have an extensive high-risk department, maternal fetal medicine in medical language, but in plain old English, it's just a high-risk department who takes care of the women who have the most severe issues prior to getting pregnant, which is really, really a big thing to do. So we're taking these women, discovering what issues they have, and addressing those issues, hopefully at the time they're getting pregnant, and even more so before they get pregnant. So we know what we're dealing with, and we can navigate and do better for them.
Huh? Evolution of a kennel.
Ellison from My Mind is Health. It is a pleasure.
Don't feed the breeders.
Thank you. Thank you.
Such an important topic. Thank you.
Restore
Now,
family
the
law.
ends on one on